Well, welcome everybody to the AJ Advisors Zoom webinar. We hope to start doing more of these in the future, just educational events that we think will find useful for our clients, which the premise of today's webinar was with Margaret Smith. We had Margaret come in a couple of years ago. We did a seminar at our church, and it was all about Medicare and Social Security that year. So with the open enrollment window that's currently going on, we thought it might be great to bring Margaret in and just kind of give an overview on Medicare again, and even have a conversation about what are things that she's advising clients or seeing clients make changes during this time, because it's easy to just be signed up for Medicare and let several years go by and not make any changes, but there are some things to really pay attention to and consider that we thought might be useful to discuss today. So if anybody has any questions, feel free to put them in the chat. We had several questions that were submitted ahead of time, so we really want to try to get to as many of those as we can. But also, if you put it in the chat, we'll try to work that in. If you have trouble with the chat, you can also email Emily, emily@ajadvice.com. And she'll let us know when we get a question to try to bring up as well. But yes, I want to start off by doing a quick introduction for Margaret. Margaret claims she's almost originally from Nashville. She moved to Nashville in 1974. Her dad was taking over her grandfather's medical practice.
Correct.
And he worked with his twin brother.
Correct. Identical
Yes.
twin.
Gotcha.
They really looked a lot alike. It confused a lot of people.
But yes, Margaret went to Southern Methodist University. Margaret, I'm not going to lie, when I was reading over this and remembered that, I had to wear my purple shirt for TCU. So, go Frogs.
Yes, okay. Go Ponies, go Frogs.
But yes, growing up as a daughter of a physician, she grew to love medicine, and it kind of led her, let's see, you also said you worked at St. Thomas Hospital?
Mm-hmm.
Yeah, working with their insurance program.
Mm-hmm.
And that's what led you to realize, hey, there's a need for this, and you wanted to start your own kind of medical advisement practice.
Exactly.
Yeah. So
Exactly.
Margaret's practice is called Medical Accounts Management.
Mm-hmm.
And if you email her, it's margaret@yesmam.com.
M.
which I've
Smith
loved.
at Yes.
M. Smith at
Yeah.
okay.
Yeah. Yes,
But
ma'am.
the yesmam.com, that's what I've always loved about it. So and she works with LBNC, Cumberland Trust, Core Civic. Those are a few corporate clients that she works with. So, I mean, Margaret knows this stuff.
I'm old. I've done it a long time. 33 years.
And yes, Margaret, you're married to Doug Smith, CEO of Hudson Wood. You've got 3 grown children, 3 granddogs, and 1 amazing grandson. So it sounds like you have a lot to keep you busy.
Yeah. Since I wrote that, I have 2 amazing daughters-in-law, and then 1 grandson and another baby on the way.
Oh,
In March.
congrats.
So we're excited about
That's
that.
great.
Well, I want to get started. We were going to ask Margaret just to kind of give an overview of Medicare, just the different parts, maybe touch on Medicare Advantage as well, but just kind of jump into it. We want to give her a little bit of time to present the overview, and then we really want this to just be a conversation. So we're going to start asking some questions that we think are relevant to open enrollment. But Margaret, I'll turn it over to you.
Okay, thank you. So there's 4 pieces or parts to Medicare. There's A, B, C, and D. They're just named after for the letters. A and B are what comprise original or traditional Medicare, and that's what we started when the program started. And C is just another name for Medicare Advantage. So, and then the D at least makes a little bit of sense. It stands for the drug plan. So with original Medicare parts A and B, A is what pays the hospital for all intents and purposes, and B is what pays your physicians. So if when you come into Medicare, that's the choice that you have to make. Do you want to keep your original Medicare card? Because everybody has to enroll initially into original Medicare parts A and B. But if you want Medicare Part C, Medicare Advantage, then we take your Medicare ID number that you've been issued and enroll you into a Medicare Advantage plan. But these are 2 completely different delivery mechanisms of your Medicare benefits, and that's the big choice that you have and the decision you have to make when you make Medicare your primary payer. So folks are like, all right, well, what's the difference between original Medicare and Medicare Advantage? The main difference is with Medicare Advantage, it is possible to have lower monthly premiums. Medicare Advantage plans are just they're private insurance companies that have contracted with the government to deliver your Medicare benefits, and all the major carriers that you can think of have Medicare Advantage plans. Blue Cross, Cigna, Aetna, even the Tennessee Farm Bureau has gotten in the game for 2023. So at least one of the options for a Medicare Advantage plan per carrier has a 0 monthly premium. Everybody has to pay the Part B premium to Medicare, whether you have your original Medicare card and keep that, or you enroll into Medicare Advantage. The only exceptions to that are if you're dual eligible, which is Medicare, Medicaid, and you would have to be below the poverty level. But if you chose a Medicare Advantage plan that doesn't have a monthly premium, then it's possible to keep your premiums at a lower level than if you kept your original Medicare card, because typically people that keep their original Medicare card will also add a drug plan, which is a separate premium, and a Medicare supplement, also known as a Medigap policy. So if you do that choice, that track, I call that the a la carte version, because every policy that you want is going to have a premium attached to it. But if you take the Medicare Advantage plan that doesn't have a monthly premium, then you would obviously have a lower monthly premium. But the main thing that you have to understand if you go into a Medicare Advantage plan, and sometimes people say, oh, it sounds like you don't like a Medicare Advantage plan. Like, that is not what, at all. What I don't like is that sometimes the Medicare Advantage people, the sales people, are very assertive, and they'll make it sound like it's the best thing since sliced bread, but it might not be the best thing for you. And the reason I say that is with Medicare Advantage, you are tied to your Medicare Advantage plan's network. So when my clients want a Medicare Advantage plan, it is extremely important that we find a plan that has all their physicians in it and covers all their medications and gets them to the hospitals that they want access to.
Sometimes that's possible, and sometimes that's not. I mean, if you have a very lengthy provider list, it is possible that they wouldn't all be in the same Medicare Advantage plan. Recently with Medicare Advantage, they have done a much better job of offering Medicare Advantage plans that have in and out of network benefits. But in the beginning, you just had to stay in your plan's provider directory, so to speak. And if you went out of network, there were no benefits.
It was all out of pocket.
Exactly. So that's the main thing. If you choose an HMO Medicare Advantage plan, no out of network benefits. If you choose a PPO Medicare Advantage plan, that means it has in and out of network benefits. And those to me make a little more sense unless you are very sure that you would never, ever, ever need to go out of network. But if you keep your original Medicare card, all of Medicare is available to you. You can see any provider anywhere that participates in Medicare throughout the US and even a US territory. So you have much more freedom and flexibility to see who you want, where you want, when you want. Because even with a Medicare Advantage plan's out of network benefits, if the physician that you wanted to see didn't participate in your plan's network, they don't have to agree to see you. And there's nothing that anybody can do to force that. So just love for people to be aware of how these work so they don't have buyer's remorse.
So what if you start with Medicare and want to switch to Medicare Advantage, or vice versa?
Great question. So you can always go from original Medicare to a Medicare Advantage plan at any time during open enrollment. And we're in open enrollment right now. It's always October 15th through December 7th. That's when you can make changes for the coming year. Always can leave original Medicare and go into a Medicare Advantage plan. There's no medical underwriting questions that are ever asked. You could be in the middle of treatment and no one can ask you anything. You're automatically accepted. For anybody who is 66 and over, who is in a Medicare Advantage plan and wants to hop back across the line, Your original Medicare card is always available to you, but you would have to qualify for a Medicare supplement. And that is what sometimes folks are not told when they enroll into a Medicare Advantage plan. They're told, oh, sure, you can go back the other way, but they leave out that very important part that you would have to qualify.
A full underwriting.
Mm-hmm.
And cost was kind of one of the main driver of Medicare Advantage, which
Right.
years ago there was a bigger savings, it seems like, but that's kind of shrunk a little bit.
So, especially now with the PPO plans that have in and out of network benefits. So, for example, Blue Advantage Garnet, that's the Medicare Advantage plan for Middle Tennessee through Blue Cross that doesn't have a monthly premium. This year, it was $6,700 was your max out of pocket. But if you went out of network, it was a combined in and out of network up to $11,300. So if you did that, you have spent more than what it would cost to have the 3 premiums keeping your original Medicare card, Part B, D, and a Medigap.
And let's touch on the premiums for a little bit. Since you're mentioning the premiums, I'm going to share this slide that you have, Margaret. Okay, so the 2023 Part B premiums, which first off, good news, 2023 premiums are actually going to be lower than 2022.
It's amazing. It
Yeah.
hasn't happened
When
in
does that happen?
well over a decade.
Oh, wow.
I
But
really,
real quick, is there a Part A premium?
there is a Part A premium for folks who did not have the Medicare taxes taken out the requisite number of years. I think it's got to be at least 10.
40 quarters.
Qualifying for
Mhm.
Social Security,
Right.
basically.
And so most folks, it's free. And that's a good thing because if you have to purchase it this year, it's a little over $400 a month.
Oh, wow.
So, and then you can
For Part A.
just for Part A.
Wow.
But even for spouses who have to draw off of another spouse's record, let's say if you stayed at home to raise your family, if your husband worked, and you can draw off of their record as the spouse. And so I don't see it as much anymore because so many women now work and raise kids and do it all. But some of my older clients that are between 80 and 90, a lot of them drew off of a spouse's record.
Or let's say you're divorced. I think if you were married for 10 years, you qualify. I know for Social Security, but
Well, the Social Security and yes, so you would be able to draw off an ex-spouse to get your Medicare
Yes.
benefits. Yes.
Yep.
Not pay the premium.
Yes.
Yeah.
Mm-hmm.
so this this layout that you have right here kind of shows your Medicare premium. Well, first off, there's a base premium. I mean, there's a base premium for your Part B premium. There's also a base premium for your drug plan. However, depending upon your tax return, your income levels, you might pay an elevated premium. And so, Margaret, I actually kind of changed your slide here a little bit just so we could talk about levels. But for instance, if you're filing a joint tax return, that's the second column. It's called modified adjusted gross income, which it's like your adjusted gross income with a few non-taxable items added back. If you're close, we can help you figure out if you're going to be subject to that or not. But if you're filing, married filing joint, if your income is $194,000 or less, you will only pay the base premium.
Correct. $164.90.
Exactly. And then yes, you would have your drug premium, which is really more specific to what drug plan you're on. Yeah.
We have 27 of those to choose from next year. 26 this year, 27 next year. So really, your drug plan depends on your personal prescription list.
And what's the broad range on the drug plan?
So next year, the least expensive plan in our area is $7.40, and it goes all the way up to over $140 a month. So, and it truly just depends on your personal prescription list, which one of the 27 is best for you.
Gotcha.
Which is why a lot of times spouses are surprised that they're not on the same drug plan. I mean, they can be, but that would mean somebody was paying more than they had to.
Right.
Well, and then, yes, as your income goes up, and it's also important to know, the government looks at your tax return from 2 years ago.
Mm-hmm.
And so if you're wondering why your premium has gone up, or we see this a lot when people have retired, they may get a letter that says they're subject to IRMA, which stands for the income related monthly Medicare adjustment out now. Yeah, thanks.
Mm-hmm.
Yeah, so like if it's 2022, they're basing it on your 2020 tax return. So there's even a form called the life-changing event form that you could submit to say, hey, I've retired, or I've reduced my work hours,
Correct.
or I've sold some income producing property. I mean, there's a whole list of different things there that you can submit to request that they kind of stop charging
Right.
that IRMA if your current year's income's lower.
That yes, that you're saying in retirement, for example, my income's gonna be lower than what you saw in 2020.
Correct.
And so I'm not gonna hit these thresholds that you see on this chart.
But you can
Exactly.
see over here on the right, yes, if you get all the way to the highest level, which a married couple would have to be over $750,000, all of a sudden you're paying $560.50 each
A month.
a month for
Yeah.
your Part B.
Right.
Then this next slide actually shows the drug plan IRMA as
Surcharges.
well. So you got the 560, and then you'll be paying $76.40 a month each for your drug plan, in addition to your regular drug plan premium.
Right. Which
So-
is why sometimes folks just say, I don't want a drug plan. So you don't have to have a drug plan. You don't have to have Medigap or a Medicare supplement. I mean, you're just going to have to pay for those out-of-pocket costs that Medicare doesn't cover. But when we see folks who are in those higher income brackets who have to have the drug plan surcharge, if they take no medications or just a handful of low-cost medications, that they could get drastically reduced prices with GoodRx coupons, things
Right.
like that.
Right.
Then we talk through that scenario, and if they're comfortable with deferring the drug plan, that drug plan surcharge goes away because you don't have the Medicare drug plan. And then obviously you wouldn't have a drug plan premium. However, if you decide down the road that you want to come back into Medicare drug plans, you're allowed to do that any year during open enrollment. You can enroll into a drug plan and it'll start January 1st of the coming year, but you'll have a late enrollment penalty. And so you just have to be comfortable with that. And also the fact that you would have to stay out until January 1 of the coming year if you got prescribed something. But there's all sorts of ways to get around that. If you don't have a Medicare drug plan, and heaven forbid you got prescribed something that was expensive, you could qualify for a manufacturer's coupon. They won't let Medicare beneficiaries who are on that have Medicare drug plans use a manufacturer's coupon, which is so counterintuitive to me. But that's the rule at the moment. Or there's Canadian pharmacies. I mean, I have lots of clients that use Canadian pharmacies, and you can get the same medications that cost, $500 a month here, like $78.
Right.
So
Right.
if you feel comfortable with that, there's just ways that you can get around that. But you would have a late enrollment penalty, and it will follow you for the rest of your life.
What is that late enrollment?
So the late enrollment penalty is they take the number of months that you were eligible but deferred. They multiply that by 1%, and then they multiply that by whatever the national drug plan premium average is for the year you decide to come in. And then whatever that number is, they round it up to the nearest 10th. So that amount is going to be added on to the premium of the drug plan you are enrolled into for the rest of your life. So if the national drug plan premium goes up a bit, you could see it increase by 10 to 20, 30 cents, however much, but it could also decrease by that much if the national drug plan premium decreases. So it's one of those things.
Yeah. Well, and maybe this is a good time. Should we talk about enrollment for Part B and how there's another lifetime penalty if you don't do that correctly?
You're talking just the general open enrollment.
General
like
open
when
enrollment.
You're first available to join
To join,
Medicare, which there's a question that was asked on that. So I'll go ahead.
Perfect.
And
Yeah.
special circumstances to avoid them.
So there's 3 different enrollment periods for Medicare. There's the initial enrollment period, and that is the 7-month window that surrounds the month in which you turn 65. Anybody who is not covered by an employer group health plan must come into Medicare in their initial enrollment period. The only people that are allowed to defer and wait till later are those that are covered under an employer group health plan or a union plan.
Or a spouse that's covered.
Correct. But you have to be the dependent of somebody who is covered.
Right.
But that initial enrollment period, that 7-month window, when you actually get online, because that's how you enroll into your Medicare benefits. You go to the Social Security website. You have to create your own personal portal there if you haven't done it already. And that is where the application lives at ssa.gov. But when you enroll in that 7-month window determines your effective date. So for our clients, we try to enroll you in the 3 months before the month in which you turn 65. And it starts the first of that month. The only exception to that is if your birthday is the first of a month, then you are effective the first of the preceding month. But if you're covered under the group plan or the dependent, the spouse of somebody who's actively working and covered under an employer or a union plan, you can defer. And so you could come in at any point. Your special enrollment period starts at 65 and 4 months. And so if you're working from 65 and 4 months all the way up to, well, last year I transitioned a gentleman in at 89.
Oh, wow.
And so there's one or two forms that we use when you come in. That's called the special enrollment period. And there's always the L564 form. That's the form that the employer would fill out. And it waives any late enrollment penalty you would have, because it proves to Medicare you've been covered under the group plan since at least turning 65. And if you already have your Medicare Part A, which everybody should have from at least age 70 onward, because you would not wait past 70 to enroll into your Social Security benefits. And once you do that, they automatically give you Part A. So if you already have your Part A, then there's a form called 40B that the enrollee fills out for themselves. It's just the information that's on your Medicare card. So those are the two enrollment periods that you want to stick to. If you get sidetracked and you don't enroll in your applicable enrollment period, then you're going to have to wait to the general enrollment period. And that is every year between January 1st and March 31st. But your benefits don't start until July the 1st. And so when that happens, you have a late enrollment penalty, and you are going to pay for every full 12 months that you could have been enrolled but didn't. You have a 10% increase in your Part B premium. So missing your Medicare Part B enrollment is a big deal.
Yeah, because it's for life.
It is, and 10% more. I mean, especially if you're in those higher brackets like that 560/50 for next year, you think you got to add 10% on every single month, and possibly for 2 people. So one of the big things that we want people to know is that if you are Medicare eligible, meaning you're 65 or older, and you're still covered under your group or union plan, if you decide to get off, and this happens sometimes because the person who was working is Medicare eligible maybe, but their spouse might not be yet. And so they're like, well, I have 18 months of COBRA available to me. I'll just wait 12 months until my spouse and I can come in together. For whatever reasons, Medicare only recognizes 8 months of COBRA as creditable coverage. So if you are 65 or older, you cannot be on COBRA for longer than 8 months. If you are, then you're going to have a late enrollment penalty that follows you forever.
So the question, Margaret, that was asked was a little bit more specific. This person is not 65 yet, retired, still covered under his former company's health insurance plan. When he turns 65, does he have to swap to Medicare then?
So if he's on COBRA, then the longest you could be is 8 months.
Okay, I think this may be where he had it was a benefit through, it was Nissan. I think he was covered on health insurance when he retired. Forgive me if I'm misremembering this. But yeah, I think he just had the health insurance provided until he became Medicare eligible.
A lot of times that's right.
If that doesn't answer the question, follow up with me and I can email Margaret and get the answer.
And I had an instance where client was sick during the enrollment period and missed it, and then worked with local politician to send in a letter on their behalf to avoid, I'm sure you've seen this, to avoid the lifetime. And they did, but it took
If you
months,
can
and it
show
was-
a special circumstance like that,
Right.
then they will make allowances. It's just how quickly you can push that through.
Right.
And so I've had to do that twice, where we've had to contact the congressperson in the client's district to get their help when all else has failed. When we
Right.
have gone through everything, we have tried it all, and we're still coming up against a brick wall. Because
Yeah.
in something like that, they couldn't, so they shouldn't be
Right.
punished for life.
Right.
Well, I think we've covered most of that.
Mhm.
What about, Margaret, since kind of the point of today's conversation was the open enrollment and, not just people's first time enrollment, but just every year, what are the things that, they should be considering? What do you see people tweaking with their Medicare during this time frame?
So most people that we have placed in or transitioned into Medicare, we don't necessarily mess with their Medicare supplement if that's the choice they took, the track they took. But we do a lot of drug plan reviews this time of year. If we know that somebody's Medicare supplement, like they started out with one company, but it's just they've increased the rates over time. Everybody's going to have an increase depending on your birthday at some point. Then if we thought we could get them a lower cost supplement, then we would look at that. But primarily it's drug plans this time of year for folks who choose to keep their original Medicare card. The drug plans can change everything about themselves from year to year. So they can increase their premiums, they can decrease their premiums, they can take medications off their formulary, they can switch them from a tier 1 to a tier 2 to a tier 3. So that's what we're looking for. We just want to make sure that you're not paying more than you have to with the drug plan. Every year, anybody who is enrolled into a Medicare drug plan, before open enrollment starts, they have to send you, it's called the Annual Notice of Change, the ANOC. And it used to look like a newspaper kind of booklet, but the very first page has the current year's premium and what your drug plan premium is going to be for the coming year. And what we like to tell our folks is look at your ANOC. If you don't see more than $3 or $4 premium increase, okay, that's fine. But make sure, because the medications are listed alphabetically in the back, make sure all your medications are still in there, and just make sure that they didn't jump tiers, go from a 1 to a 3 or a 1 maybe even to a 2, because chances are there's a plan out there that will do a better job for you. That's why we have 27 plans to choose from, because the formularies are not all the same. The restrictions like prior authorizations or step therapies, those are not all the same. So they're available for when circumstances change. And especially if you add an expensive drug, or let's just say you were taking 10 generic drugs, but for the coming year, you may only be taking 5. Well, chances are there's a better plan out there for you. So we do a lot of that. And then we have folks who maybe got a letter from their provider's office that they're no longer going to be in their Medicare Advantage plan. So when that happens, we got to find another one, unless they want to change doctors, which most people are not interested in doing.
Right.
So we can do that, or if they just want to not have to worry about the network and they can qualify to get a Medicare supplement, we can move them back over to traditional Medicare. And interestingly enough, for whatever reasons, Medicare Advantage folks have an additional 3 months of an open enrollment period. That started a handful of years ago, but they actually have through May 31st to make a change. So not sure why they are given that extra situation, but most people, if you want your new plan to begin January 1, you have to do it between October 15th and December 7th.
Gotcha. Let's touch on Medicare supplement a little bit, the supplement plans.
And you mentioned that, I think, at the beginning, but just to be very clear on what the supplement plan is. I mean, again, the Part B is your doctor's plan, the Part D is your drug plan, but Medicare only covers 80% of costs.
And so physician fee.
Yes, so the physician fee. And so that's where the supplement plan comes in. People will buy it to cover that other 20%.
Well, there's also some other Medicare out-of-pocket costs. So if you have your original Medicare card, Parts A and B have deductibles every year. And the A deductible, the hospital deductible, next year is $1,600. And that one's significant because it resets to 0 every time you've been out of the hospital for 60 consecutive days. So if you go back in on the 61st day, you have another hospital deductible to meet. But most people's Medicare supplement is going to pay that Part A deductible every single time. You would not have to worry about that. We have 11 different Medicare supplements to choose from, and 9 are available to everyone. The other 2, you would have had to have been at least 65 by January the 1st of 2020 to be eligible to purchase a C or an F. They're super fancy. They're all named for letters of the alphabet.
Which
A
is even
through
more
N.
confusing because you have A,
Exactly.
B, C, D parts of Medicare.
Right.
Then your
exactly.
supplement plan is A through
Right.
N.
Yeah, they don't make it easy. It's so confusing. But as you can see with that slide, those percentages are what the supplement picks up after Medicare has paid its portion of the claim. So where you see 100%, that means between Medicare paying and what your supplement pays, 100% of that claim is going to be covered. So the C and the F were the only 2 Medicare supplements that pay both the Part A deductible, the one that resets every 60 days, and the Part B, the physician deductible. That one's an annual deductible. And
Which
next
is
year,
how much next year?
$226. So the G is really the most comprehensive plan that the majority of people can now purchase, unless you were 65 by January 1 of 2020. But the G, the only difference between the G and the F is you are responsible for the Part B deductible. That's it. So if you have a Medicare G plan next year, your only out-of-pocket expense is going to be $226 outside of paying those monthly premiums.
But F used to cover that. So people that used to, because F you can no longer sign up for. They just
Well,
continue to
unless you were, for my folks, let's say
Oh,
somebody
okay.
is coming into Medicare and they're 70. Well, they would have been 65
Gotcha.
by 1/1/2020. They were at least 65. That's the rule. So there are still pockets of people that are eligible to purchase a C or an F. But F is the most expensive. And especially if you're coming in at the full year, if you compare what the F plan premium is to the G, even backing out your out-of-pocket responsibility of $226, you've saved money.
So who provides these plans? How does this
Oh.
work? You got your letter, but who's your actual insurance through?
So the Medicare supplements are all issued by the private insurance carriers, and they're just there to pick up the out-of-pocket costs that Medicare doesn't cover. So again, it's all the major insurance carriers that you can think of: Blue Cross Blue Shield and Aetna and Mutual of Omaha and
Cigna.
AARP, United Healthcare, Cigna, Manhattan Life. I mean, and depending on where you live in your region, you may have others that are available to you, because you have to purchase a Medicare supplement based in your own state. The nice thing about the Medicare supplements, if you have original Medicare and a Medicare supplement, if you were to move, it just goes right with you. You don't have to change your Medicare supplement. And for some of my folks who like to retire and go, to Florida, per se, their Medicare supplements are so much more expensive than they are in Tennessee. So if they turn 65 or retired and got their Medicare supplement while they were living in Tennessee, they're paying a lot less than their buddies in Florida.
Yeah.
They keep the Tennessee plan when they move out of state with that
Absolutely.
premium.
Absolutely. I mean, you can switch if you could qualify via medical underwriting, but a lot of times our Tennessee premiums are better than other states.
That's good to know.
That's interesting.
Let's see, where do we want to go now? Well, here's one I know we wanted to make sure to because it was asked as a question too about, does Medicare cover long-term care situations? Can you talk about that for a little bit?
So glad somebody asked that. So Medicare does not cover anything that has to do with the activities of daily living. So if you needed to go into skilled nursing after, let's say you had a hip replacement or a knee replacement, or just have been in the hospital a long time and you need to get your strength back, you go to a skilled nursing facility, which is really just like in our area, I'm just going to use some examples, like a Richland Place or a Blakeford. It's usually a CCRC that has a skilled nursing facility portion of it. And Medicare will pay 100% of that for the first 20 days, and that's even Medicare Advantage, if you've been an inpatient for at least 3 days. So after that, if you're in Medicare Advantage, you're going to have to pay a copay. This year, it's typically around $185 a day. if you had a Medicare supplement, it would pick up that cost. You wouldn't have any out-of-pocket costs. And if you, so Medicare will allow you to stay at the skilled nursing facility and have your rehab until they decide you have plateaued. So it is up to the folks that are there to keep showing to Medicare that you're improving. But once you kind of get there, or you're unable to progress any further, that's when the benefits stop. And that is when, if you had a long-term care policy, that is when that would start helping. If you had to continue to stay in the nursing home because you couldn't go home. But those are separate policies. That has nothing to do with Medicare. You would have to purchase those on your own. But they take care of what we call the activities of daily living. If you needed a caregiver to come into your home and help you with
eating, bathing, transferring,
absolutely,
continence.
absolutely.
There's 6 of them.
And but Medicare is not going to cover that. Medicare Advantage plans now can offer some help if you come home from the hospital and you need some help with the activities of daily living. That was allowed a couple of years ago. Honestly, I haven't seen any plans yet that offer that, but I haven't really scrutinized for 2023. So maybe some more in our area are going to offer that as a benefit, but it's a finite amount of time. It's not forever. So if you need help for a very long time, that is long-term care insurance.
Well, yeah, the specific question was, I'm trying to establish if I'm properly covered, especially if I should require hospitalization or long-term care. So again, long-term care insurance is a much different insurance that addresses the long-term care situations long-term. And most people with Medicare coverage are pretty happy with their insurance. I mean, it's pretty broad and covers. Yeah,
it is. It really is.
So if you have those two pieces, you're in pretty good shape.
Absolutely. Absolutely. That's a great question.
And going back a little bit, say I'm turning 65 and I'm enrolling online or I'm working with you. What am I considering? How do I go about, the Part B is what it is, but where do you go from there in terms of let's select the best plan for you? What is the info you need and the conversations you have?
So unfortunately, there isn't a website that you could go to that would show you all the Medicare supplemental plans that are available to you in your area. You can look at all the Medicare Advantage plans and all the drug plans, and that's through, I'm on it continuously throughout the day, that's medicare.gov. That's the website that's going to show you everything that is available to you based on your zip code as far as Medicare Advantage and those drug plans. But to determine which Medicare supplement would be best, it's unfortunate that we don't have a database like that. You could go to the individual carrier websites if you kind of were like, all right, I want to compare between Blue Cross and Cigna and Aetna, Farm Bureau, what have you. You would have to go to each one of those websites and put in your information, and then it would give you a quote. But this is what's so important to know. All the Medicare supplements, the slide that John showed us, they're all the same benefits. They're all the same policies, no matter whom you purchase them through, but every single carrier has a different price. And so for my clients, I just like to go with the least expensive plan. And you say, well, why is that? Shouldn't we be worried that, maybe if you pay a little more, you get more? Not necessarily. Sometimes you get a silver sneakers benefit, which is a membership to some kind of exercise facility. The Y used to be a part of it, but not anymore. They got out a couple of years ago. But depending on the age in which you come into Medicare and get your Medicare supplement, some carriers will keep your premium steady if you come in at 65 for the first 2 years, some are the first 4 years. But if we know that eventually your premium is going to start going up the month after your birthday, and it goes up about 3%, then you want to start off at the absolute lowest level, because sometimes you would be shocked at the difference between carriers. I mean, you could be paying $20 more a month for the exact same thing, which is only going to increase over time as you age. Now, AARP United Healthcare is community rated. They're not attained age rated, but you still have an increase. It's on your policy anniversary date. They give you 10 years of discounts off of what their cost is of the premium, but every year the discounts decrease. So you still get an increase yearly. It's just because your discounts are decreasing, and then by year 10, you're paying full freight, whatever they decide. And then the other crazy thing about the supplemental carriers is, again, depending on the carrier, every 2 years, every 4 years, they decide to change every single number in their rate sheet. So everybody gets a rate increase when that happens. And then if it's a year for you to get an applicable birthday bump, then you'll have 2 rate increases in 1 year. So again, if we know they'll increase eventually, you're protected by law if your Medicare supplemental carrier decided to get out of the business, or if they went belly up overnight, you would have lost your coverage through no fault of your own. And so you could go and purchase another one, and no one can ask you any medical underwriting questions. So you're protected that way because it wasn't your fault that you lost your coverage. So if we know you're protected and there's no downside to it, then I just think it's important to find the least expensive Medicare supplement.
Because the 10 insurance companies offer Plan G, but it's the exact same coverage.
Right.
It's just a different premium.
And you'll have 10 different premiums.
Which is also why I guess you're not seeing people don't change their supplement very often, because if they're like with that G plan and they're happy with the coverage, it's not like they're going to try to make a move to another. Or you can always move down in the plans. Is that
So
right?
depending on the carrier, if you want to show that supplemental slide, or are we still on it? Depending on the carrier. So if F sits at the top of the pyramid, if you wanted to move to the right of F down to N, some carriers will allow you to do that because you are purchasing a plan with lesser benefits than the one you started with. Others will look at your claim history and decide if they're going to let you leave. So if they decided you couldn't leave, then you could see, well, could I pass somebody else's medical underwriting questions and leave? But like the Tennessee Farm Bureau, if you started, well, they no longer sell the F, but if you started off with the G and later on decided you want the N, you don't have to qualify for that. They'll let you do that because
But
it
if
has less benefits.
N to G, you're gonna
Yes,
have to.
go in the opposite.
Or I mean, I guess, does anybody ever say, oh, I don't like being with this insurance provider, maybe I'm concerned about their stability? What if you wanted to change to a different company, even if it was the same plan? Can you do that, or do you have to go through underwriting?
You have to go through underwriting.
Okay.
So
You would want to wait until they went out of business.
Well,
and
this
then you
is,
get the no fault of your own. Yeah.
I don't think any of these major carriers are going out of business, but we do have folks that come see us during open enrollment to see if they can get if they qualify and if they can get the same plan less expensively from someone else. And
Okay.
so the first thing we do is look at the medical underwriting questions, and some carriers have more medical underwriting questions than others.
Gotcha. Let's make sure we hit on some of these other questions. Can you touch on TRICARE? We had a couple questions about TRICARE. How does that work with Medicare? What do you need to consider? We talked about it a little bit before.
Mhm.
It sounds like you never ever want to let
Yeah,
it go.
TRICARE
So-
is fantastic. So if you qualify for TRICARE, and especially TRICARE for life, it becomes your secondary carrier. So between Medicare and your TRICARE, you're golden.
And how do you qualify? Sorry,
Well,
just
you
to-
would have to have worked for the military for a certain amount of time, and I don't know what the qualifications are. We could Google that, but I have had a handful of clients over the years that do have Medicare and TRICARE, or they'll come in and they say, I currently have TRICARE and it's time for them to transition into Medicare. And I'm like, oh, well, we're not touching that. Like, we wouldn't need to get a Medicare supplement or a drug plan. You wouldn't want to give up your TRICARE to go into a Medicare Advantage plan. They wouldn't coordinate. So you really are in a fantastic position if you've got TRICARE. Same thing just occurred to me. If you are like a Metro retiree, retirees, government employees have plans that aren't like the ones that just you or I would be eligible to purchase.
Mhm.
So we always like, if somebody's, let's say they were a school teacher, we always want them to bring those retiree plans so we can compare them. And if what they are offered through being a retiree is better than what we could get them, just what most of us would be qualified for, then we absolutely keep the retiree plan. So it's important, if you have that available to you, to understand exactly how those benefits work, because sometimes they're a lot better, especially with those drug plan surcharges.
Mhm.
And typically those retiree plans, they're not true Medicare drug plans. So if you're in a higher income bracket, you would not have to pay the drug plan surcharge. And typically those plans are just copay plans. So you pay far less out of your pocket than the way the Medicare drug plans are structured.
So you still have to pay the Part B surcharge, but not the prescription.
No, you wouldn't even have to pay the Part B, well, the drug plan surcharge.
The drug plan.
You would have to pay whatever your applicable Part B is,
Right.
but you wouldn't have to pay the drug plan because
Right.
it wasn't an official Medicare drug plan. It
Right.
was your retiree plan.
Gotcha.
This was a interesting question, Margaret. What is the number of different insurance companies that you've referred clients to for Medicare supplement? I guess the heart of the question is like, do you have your favorites, or are they all kind of, yeah?
Well, it's interesting because if we have clients all over the U.S., and so clearly the ones that are best for our folks that live in other states, I try to find the 3 least expensive, and I'll just use as an example, like G plans in their area, because I like to go with whatever's the least expensive, but I want to show them. And so those carriers can vary depending on the state. But for my Tennessee clients, I would say probably the top 3 that we work with are the Tennessee Farm Bureau, believe it or not, Mutual of Omaha. They give spouses discounts, as does Cigna. So we oftentimes look at Cigna. And every once in a while, folks will be interested in United Healthcare, which is AARP, just because they get a lot of publications. They send a lot of stuff. But honestly, their premiums, if we're just looking at apples to apples on the price, are more expensive. So if somebody, we're going to do whatever the client wants. They want to go to Blue Cross Blue Shield of Tennessee, we're going to put them in Blue Cross Blue Shield of Tennessee. And so if they want United Healthcare, we're going to do that. But sometimes you're paying more for the exact same thing.
Mhm.
We're trying to save them money so you can invest it for
There
them.
we go.
That's why we love
what
Margaret.
it boils down to. All right, we've got another question. Client who's turning 65 have a dependent, a child, 11-year-old dependent. What do they do in that situation to keep everyone insured? What are the options there?
Okay, so if you're covered under that employer plan, you can continue to stay on that and cover that younger dependent. But if you decided to transition into Medicare, the dependent is going to have to get its own plan. So you could either do a marketplace plan, healthcare.gov, Obamacare, whatever you call it, or you could look at a non-ACA.
The Farm Bureau has
right.
some.
Yeah.
Probably
yeah.
one of the bigger in Tennessee.
Right. But they would eventually, once they came into Medicare, they would have to get their own plan. They would have COBRA available to them
Right.
for 18 months, but eventually they'll have to get something else.
But that COBRA being for the child, not for
Correct.
the retiree past
Correct.
the 8 months.
Correct. Just
Yeah.
for the child.
Yeah.
Just for the child.
Yeah.
This was a good question. I know a lot of people get frustrated with. We've been happy with our Medicare choices, except we were truly surprised with the donut hole as we were paying for cancer medications. What is your advice there?
Oh, it makes me so sad. So there are 4 coverage phases to the drug plans, and that's whether you're in a Medicare Advantage plan that comes with a drug plan attached or a standalone drug plan. They work the exact same way. And so the 3rd coverage phase is called the coverage gap or the donut hole. And honestly, there's nothing really you can do about that, except I think the person said it was for cancer medications. A lot of times I have found that for our clients, their oncology provider has access sometimes to these grants that our clients are eligible for. And so they can get their medications drastically reduced that way. And it's not based on income. So I would ask the provider, for most chemo drugs, those are called Part B drugs, especially if they're at the infusion clinic at the oncologist's office. It runs through your Medicare Part B benefits. It's not a Part D. Only the drugs that you are given a prescription for and have to go pick up at the pharmacy. But even those are the ones that our clients have found that they've been able to get a grant for or qualify for some other help. So I would absolutely ask for that. But other than that, the best it gets is catastrophic coverage. It's the fourth and final phase. If you reach the fourth and final phase, that means next year that $7,400 has been paid between you and your insurance, your drug plan, the insurance carrier, towards the purchase price of your medications. And at that point, you're paying 5% of the negotiated rate between your drug plan and your pharmacy. And you stay there until everything resets to zero January 1. But if you're taking those expensive medications, I do think it's important to look at your drug plan every year, because somebody might do a better job, and just see if you could save a little money. Help is on the way. With the Inflation Reduction Act, there are changes coming to the Medicare drug plans over the next 10 years. And by 2025, we are supposed to have a cap. Heretofore, it's been a never-ending bucket of money where you're going to pay 5% at the lowest point. But I don't really know exactly all the details. It gets a little smushy when you're trying to figure out exactly how this is going to play out, as evidenced by in 2025, they say there's going to be a cap of $2,000, but I can't decide if that's just on a handful of the most expensive drugs if you're taking those, or if that's going to be across the board. I think we have to wait till we get a little bit closer. But the bottom line is help is finally on the way for folks who have these very expensive drugs and they're continuously paying something every month. There's going to be an out-of-pocket maximum for the first time ever. Next year's big change is for anybody who has takes insulin, and they're going to have to cap the insulin at $35. You might pay less than that, but you can't pay any more. Now that doesn't include the brand name like Trulicity or Wegovy or some of these other more expensive Ozempic pens, brand name pens. But hopefully that's coming down the pike.
Well, that would be good. I think that covers most of the questions. I don't know if there's anything else, Margaret, or Andrew, do you have any other?
We will distribute these slides.
Yes, if anybody would like a copy of it, just email us. Margaret, if you're okay with us sharing that.
Happy to share.
And yeah, I want to pull up Margaret's information here. I mean, we just can't say enough about what a great resource she has been for our clients, and just you're always available to help us with one-off questions as they come up, and we, it is just a major
Our pleasure.
value to us. So we thank you for all
We
your
don't
help,
want
Margaret.
anybody getting a late enrollment penalty.
Yeah, there
If
you
we
go.
can help it, not on our watch.
Well, thank you. I think this has been, hopefully our clients have enjoyed this format, and we would love your feedback, or if you have other topics that you would like us to do a conversation like this. But Margaret, we really just appreciate your
Thank you so
time.
much
Yeah,
for the
no,
opportunity.
coming out to help
I
us.
love
Absolutely.
talking about it. We've got to educate people.
That's right.
You were
That's what it's
passionate
all
about it, and you were good at it. So
Yeah,
that's a
that's
good
crazy.
combo.
Yes, thank you for joining us today.
Yeah.
Well, thank you, everybody, and hope you all have a great evening. And if you have any follow-up questions that we didn't get to or that you weren't clear on, email them to us. We'll follow up with Margaret and get those
Absolutely.
answers for you. So take care.